Hello, my name is Elian Morocho Sanchez. I'm talking about marine entry fatty acids and prevention of cardiovascular disease and cancer. Definition: cardiovascular disease is a broad term for problems with the heart and blood vessels. It is the heart condition that manifests itself through these blood vessels. Structural problems and blood clots. These problems are often due to atherosclerosis. Marine entry fatty acids. In chemistry, particularly in biochemistry, a fatty acid is a carboxylic acid with a long aliphatic chain, which is either saturated or unsaturated. They are found in high proportion in the tissues of oily fish and certain saltfish, in some plant sources such as soybean oil, canola oil, walnut, and flaxseeds. Cancer. This is a process of uncontrolled growth and dissemination of cells. It can appear almost anywhere on the body. Such multiplication in the number of cells comes to form masses, called tumors or neoplasms, which in their expansion can destroy and replace normal tissues. Application in medicine. Epidemiological and clinical evidence suggests that an increased intake of low-chain N3 fatty acid protects against normal mortality from coronary artery disease, have a beneficial effect on diseases such as lupus erythematosus, type 2 diabetes mellitus, cancer, atherosclerosis, hyperlipidemia, metabolic syndrome, help reduce the risk of heart disease, promote healthy skin, help lower levels of certain blood fats, and to raise levels of good cholesterol.
Trials have shown a beneficial effect of N3 polyunsaturated fatty acids in patients with a previous MI or heart failure. Now in the New England Journal of Medicine is a report of the potential benefit of such therapy in patients with multiple cardiovascular risk factors or atherosclerotic vascular disease who have not had an MI. The trial enrolled a cohort of patients in Italy. Patients were randomly assigned to 1 gram daily of N3 fatty acids or olive oil as a placebo. Cumulative rates of death, non-fatal MI, and non-fatal stroke were studied. At 1 year, after the event rate was found to be lower than anticipated, the primary endpoint was revised as time to death from cardiovascular causes or admission to the hospital for cardiovascular causes. Here's the outcome. 12,500 patients were enrolled, a median of 5 years of follow-up. But in this large general practice cohort of patients with multiple cardiovascular risk factors, treatment with N3 fatty acids did not reduce cardiovascular mortality and morbidity. There was absolutely no difference between the two groups. So for all of you taking N3 fatty acids for primary prevention, it might be useful to save the money instead. I'm Peter Block, and this is a CardioSource Heart Minute.
Pros and cons. Pros: reduce the amount of triglycerides in the blood, reduce the risk of arrhythmias, they help to slightly lower blood pressure. Cons: it can increase the risk of colitis. These fatty acids can alter immune function and increase the risk of advanced prostatic cancer.
What are the most three important types of omega-3 fatty acids? 1. ALA, alpha-linolenic acid. This is the most common omega-3 fatty acid in the diet. ALA is mostly found in plant foods, and needs to be converted into the EPA or DHA before it can be utilized by the human body. ALA is found in many plant foods, including kale, spinach, and purslane. ALA is also found in many seeds such as chia, flax and hemp seeds. 2. EPA, eicosapentaenoic acid. It is an omega-3 fatty acid that can reduce symptoms of depression and help fight inflammation in the body. Chronic, low-level inflammation is known to drive several common diseases. Both EPA and DHA are mostly found in seafood, including fatty fish and algae. For this reason, they are often called marine omega-3s. 3. DHA, docosahexaenoic acid. DHA is an important structural component of skin and the retina in the eye. DHA is absolutely vital for brain development and function in childhood, as well as brain function in adults. Fortifying baby formula with DHA leads to improved vision in infants. The role of DHA in heart disease is also well established. It may also help protect against cancer and other health problems. It can reduce blood triglycerides and may lead to fewer harmful LDL particles. So the most abundant omega-3 fatty acids in the diet are ALA, EPA and DHA. Contact us for more information.
Issue applied in Ecuador. Omega-3 research conducts on the consumption of fish and omega-3 capsules in Ecuador revealed that up to 41% of our daily diets contain fish, which promotes health, provides nutrients for the brain and eyes of babies, and avoid vascular problems for the elderly.
Aquaculture produces more fish for human consumption than all wild seafood catch. Just like people, fish need to consume omega-3 fatty acids found in fish oil. Healthier fish means healthier people. This is particularly true for salmon. In current aquaculture practice, algae is eaten by plankton, which are eaten by small fish, that are then caught and turned into fish oil for the salmon to eat. However, this process consumes 75% of the world's finite fish oil resources, and 50% of that amount is consumed by salmon aquaculture, which may become unsustainable as global population continues to grow. DSM and Evonik have found a better way. By providing the omega-3 fatty acids directly from natural marine algae, we no longer need to deplete the ocean for aquaculture. Marine algae are nature's source of the key ingredients of fish oil, namely EPA and DHA. This concentrated algae oil is the healthiest and most sustainable source of omega-3 fatty acids for salmon. People expect salmon to be a rich, safe, and reliable source of omega-3s to support our brain, heart, and eye health. Our technology will enable the global aquaculture industry to meet the increased demand for fish and grow sustainably. Introducing natural marine algae technology by DSM and Evonik.
Conclusion. Supplementation with marine omega-3 is associated with a lower risk of myocardial infarction. Total coronary heart disease at higher doses it can cause advanced prostate cancer, arrhythmias, although it has not been much evidence and study. It's all. Thank you.